Over the last few years, cyclin-dependent kinase inhibitors have come into clinical practice on the basis of doubling progression-free survival. And it's very elegant biology that led to the whole pathway where we are now. And as is the case with patients with hormone receptor positive breast cancers, most of our therapies have been designed to extend progression-free survival. And the question as to whether survival is ever impacted has been very hard to address in this population, in part because even when they progress, they tend to live for many months or even years after that, so it's been hard to demonstrate. So thus far, of all three of the CDK4/6 inhibitors approved, they've all roughly demonstrated about a doubling of progression-free survival. And most of these trials were designed with that as the primary endpoint. However, they also had a survival analysis built in as a secondary endpoint that was triggered after a certain number of death events had been reached. And so this is the first trial to have reached that landmark and actually shown a survival benefit. So it was a little bit of a surprise actually, but certainly gratifying, because many people look at that as the gold standard as to whether a drug should be approved. Now, I and many other people don't agree with that, because if you can delay progression, especially also improving quality of life, then it's a real benefit. But nevertheless, at the time of the pre-specified numbers of death, that triggered the survival analysis, and that was strongly statistically significant, favoring the ribociclib arm.